Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Chemotherapy for breast cancer. Adriamycin and Cytoxan. Introduction. Breast cancer is the most common type of cancer in women worldwide. Your healthcare provider has recommended chemotherapy for your breast cancer.
Chemotherapy includes powerful drugs that kill or control the growth of cancer cells.
This program will help you understand better the benefits and risks of the chemotherapy drugs Adriamycin, doxorubicin, and Cytoxan, cyclophosphamide.
Cancer and its causes. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Cancer occurs when cells keep dividing and growing without the normal control. Cancer cells may also spread to different parts of the body through blood vessels and lymph channels. Cancer treatments are used to kill or control these abnormally growing cells. Cancers in the body are given names depending on where the cancer originates.
Cancer that begins in the lung will always be called a lung cancer, even if it is spread to another place, such as the liver, bone, or brain. Healthcare providers usually cannot know what caused cancer in an individual patient. Each cell contains hereditary or genetic material called chromosomes. This genetic material controls the growth of the cell. Cancer always arises due to changes that occur in this genetic material. When the genetic material in a cell becomes abnormal, it loses its ability to control the growth of the cell.
These sudden changes in genetic material can occur for a variety of reasons. They may be inherited from parents.
Changes in the genetic material may also happen as a result of exposure to specific infections, drugs, tobacco, or other factors.
Breast cancer.
Breast cancer can occur in women after puberty and becomes more common as women age.
Breast cancer may also occur in men. However, this is rare. Hormones are chemicals in the body that help regulate body functions. For instance, the hormone estrogen helps control menstrual periods in women. Breast cancer is sometimes influenced by hormones. Some patients take medicine that gives them additional hormones. These hormonal medications may also affect breast cancer.
For this reason, your healthcare provider will want to know information about your menstrual periods and any hormone medications you may have taken. Early forms of breast cancer have not spread to other parts of the body. These early forms may be found through breast X-rays known as mammograms.
Stages of cancer. Once the cancer is found, it is important to determine how much the cancer has grown. It is also important to determine if the cancer has spread to other parts of the body.
These two pieces of information help your healthcare provider determine the stage of the cancer. This stage is used to determine the treatment that will be recommended. Your breast cancer was carefully analyzed by a pathologist. The pathologist is a healthcare provider who examines a sample of your cancer under the microscope and performs special tests to help determine whether treatment with hormonal medication is recommended. Your healthcare provider will tell you what stage your cancer is in. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Treatment after surgery. Surgery helps remove lumps of cancer. However, it may not be possible to remove or kill every cancer cell. Cells are very small. 1 million cells can be the size of a ballpoint on the end of a pen. 1 million cancer cells would also easily fit within the eye of a common sewing needle. Even with the most advanced equipment, cancer cells that cannot be seen or felt may be left behind after surgery.
For this reason, your healthcare provider may recommend additional treatments after surgery. These are known as adjuvant treatments. Adjuvant treatments may include further surgery. Adjuvant treatments also include radiation therapy. Adjuvant treatments also include drug therapies. Drug therapies may include hormones, chemotherapy, targeted therapy, or biological therapy, also known as immunotherapy. These additional treatments reduce the risk that the cancer may recur. However, they do not guarantee it. For this reason, your healthcare provider will want you to come back for follow-up appointments in the months and years ahead, even after the adjuvant treatments have ended. Chemotherapy may also be given before surgery to shrink large tumors, for example. This can make them easier for the surgeon to remove.
If the cancer should recur, additional treatment may be used. Chemotherapy.
Your healthcare provider has recommended chemotherapy for your breast cancer.
Chemotherapy includes powerful drugs that kill or control the growth of cancer cells.
The chemotherapy that your healthcare provider recommends for you is very specific to your type of cancer. Cancer patients have different experiences with chemotherapy. Therefore, it is hard to compare what effects the chemotherapy may have on you. Chemotherapy may have different effects on different patients. After chemotherapy, you will have follow-up appointments so your healthcare provider can pay close attention to your health.
Treatment.
Your healthcare provider has chosen a combination of Adriamycin, doxorubicin, and Cytoxan, cyclophosphamide, to reduce the chance of breast cancer recurrence. Adriamycin is given intravenously. Cytoxan can be given intravenously or in pill form. Giving the drugs intravenously will involve having a needle inserted into a vein, usually in the arm. The liquid chemotherapy will flow into your body through the needle over several minutes. How many treatments you will need and how often depend on your specific case. The following sections will review the risks of chemotherapy in general and the side effects of drugs your healthcare provider recommended for you. Risks and side effects.
The side effects from chemotherapy are usually not life-threatening but can be temporarily uncomfortable. Most of the side effects will last only a matter of hours. There may be rare effects that could persist in the body for many years. However, serious long-term consequences are relatively unusual. Women who are having periods may have their periods become irregular or stop during or after chemotherapy, and early menopause may occur.
Sometimes, however, the periods may begin again during or after chemotherapy. It is very important that women discuss the need for birth control with their healthcare provider. Chemotherapy may also cause some damage in the chromosomes in both men and women. Your healthcare provider recommends that you do not have children for a period of months or years during and after chemotherapy. Adriamycin. Adriamycin is a chemotherapy drug. Its generic name is doxorubicin. Adriamycin is given intravenously. Adriamycin can cause a number of side effects and usually results in patients losing their hair several weeks after the chemotherapy has begun. The hair eventually will grow back, but will do so slowly and may not be as full as it was initially. Adriamycin can lower the number of white blood cells in the body. White blood cells help fight infections. This low white blood cell count may begin several days after the drug is administered and may persist for several days. Because the number of white blood cells is lower, the body's ability to fight infections is reduced. That is why patients should notify their healthcare provider if any signs of infection occur. Signs of infection include fever, chills, earache, headache, cough, burning feeling while peeing, general symptoms of sudden illness. Serious infections can be life-threatening. That is why you should immediately inform your healthcare provider if you notice any signs of infection. Except for possible infections, other side effects of adriamycin are rarely life-threatening. Your healthcare provider will draw blood for laboratory testing to measure your white blood cell count during your treatments. This will assist your healthcare provider in monitoring for possible infections and in determining the appropriate drug strength. Adriamycin can also cause weakness, fatigue, and occasionally mouth soreness. If your mouth or throat does become extremely sore, you should contact your healthcare provider. Rinsing with a glass of water with a teaspoon of salt will often help. Adriamycin can produce damage to the heart muscle if given in very high doses or given over a long period of time. Your healthcare provider may wish to perform tests on the heart before and/or after treatment with adriamycin. Adriamycin is colored red and may cause your urine to briefly turn red several hours after the drug has been given. This is of concern only if the discoloration of the urine persists for more than 24 hours after the drug is given.
Cytoxan. Cytoxan is a chemotherapy drug. It is also called cyclophosphamide.
Cytoxan can be given either by injection through a vein or in pill form. The type of cytoxan that is best for your cancer will be determined by your healthcare provider.
Cytoxan can also lower the number of white blood cells in the body. White blood cells help fight infections. This low count of white blood cells may begin several days after the drug is administered and persist for several days.
Because the number of white blood cells is lower, the body's ability to fight infections is reduced. That is why patients should notify their healthcare provider if any signs of infection occur. Signs of infections include fever, chills, earache, headache, cough, burning feeling while peeing, general symptoms of sudden illness. Serious infections can be life-threatening. That is why you should inform your healthcare provider right away if you notice any signs of infection. Except for possible infections, other side effects of Cytoxan are rarely life-threatening. Your healthcare provider will draw blood for laboratory testing to measure your white blood cell count during your treatments. This will assist your healthcare provider in monitoring for possible infections and in determining the appropriate drug strength.
In the body, Cytoxan can produce chemicals that irritate the bladder. For this reason, it is important to drink extra fluids and empty your bladder more frequently for 24 hours after receiving this drug. This will help prevent bladder irritation.
Any blood in the urine should be promptly reported to your healthcare provider. Cytoxan can also cause weakness, fatigue, mouth sores, and diarrhea. If your mouth or throat does become extremely sore, you should contact your healthcare provider. Rinsing with a glass of water with a teaspoon of salt will often help. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Special treatment is needed to kill cancer cells that cannot be seen or removed by surgery. Chemotherapy is the use of powerful drugs to kill cancer cells remaining in the body or to limit their growth.
Chemotherapy as well as other adjuvant treatments reduce the risk that the cancer may ever come back, but they do not guarantee a cure. The chemotherapy that your healthcare provider recommends for you is specific to your type of cancer.
Chemotherapy drugs have some side effects and risks. Knowing about them will help you detect and treat them early if they happen.
Thank you for using Explain.